So I totally forgot about this class, okay? And thank you for reminding. Okay, now coming to the revision class. As you all know, your exam will be on 12th of June and your final exam will be for 50 marks. And you will have all MCQs, 50 MCQs for 50 marks. And the duration of exam will be for 90 minutes, okay? I think it is starting at 1 o'clock. 1 o'clock or 12 o'clock. Okay, so whatever is the time, so you will have the complete time for answering 50 MCQs. Now, as you all know that this is an annual course and you have, I agree that you have many lectures for your final examination. So what we can benefit is from this revision class is to listen to this revision class carefully and follow it so that you can score maximum marks. If you listen to it carefully and follow the steps while you are preparing for your pharmacology final exam. So, your syllabus is divided into 3 parts. Okay, so divide your syllabus into 3 parts. In the first part, include the antibiotics, the antiviral, the lecture for antiviral and anti-cancer agents. Okay, so the first part will include lectures related to antibiotics, all the antibiotics, the antiviral, antifungal agents, and anti-cancer agents, and oral health condition lectures, like all the agents which are used for improving the oral health condition. Okay, if anything is not clear, you can interrupt and ask me now. Okay, the second part of the syllabus, you can divide the lectures. The second part will include lectures related to emergency situation. Open each lecture. It's very difficult. I will open the important things what I have to tell. First, listen to the divisions. Okay, if you want, I can share. Okay, so okay, I think this is better. Okay, so divide lectures into 3 parts. Okay. Okay, 3 parts. Okay, part one. Part one is, as I told you, antibiotics, antiviral, oral health conditions, and cancer. Okay. Part two include all the lectures which are related to emergencies. Okay, emergencies like medical emergency, fear and anxiety, poison patient, shock, etc. Okay, and then we have the part 3, which includes the pain, NSAIDs, opioid analgesics, everything related to the pain, prescription writing, and then we have the last lectures, okay, geriatric pharmacology, drug of abuse, toxicology, all the last lectures. Clear? So far so clear, all of you? 3 parts, okay? So while you're studying, you are dividing the lectures into 3 parts. Okay, clear? Girls and boys. Oh my goodness. Clear, okay. Manar says clear. Anybody from the boys? You can't hear. Abdullah. See, I'm repeating it again. The yes, you have to divide while you're preparing for your examination. Divide the lectures into three parts. Part one will include lectures related to antibiotics, antiviral, oral health condition, and cancer. Part 2 will include all the lectures related to emergency situations like medical emergency, fear and anxiety, poison patient, shock, etc. And part 3 will include lectures related to pain. We have opioid analgesics, NSAIDs, then we have the prescription writing, and the last lecture, that is the geriatric pharmacology, drugs of abuse, toxicology, etc. Clear? Three parts while you are studying the lectures. Understood, all of you? Yes, you will have all the lectures in your final exam. Okay, great. Now, coming to the first part, that is part number one, antibiotics. You know that there are many lectures related to the antibiotics, right? You have the introduction, then you have the beta lactam, sulfonamides, then you have tetracyclines and aminoglycosides, like, right? So you have so many lectures related to the antibiotics. So what you can do is the assignment which you have submitted to me, right, related to the antibiotics, that assignment you have to study. Okay, the table which you have submitted to us, which was having a table with all the what do you say, antibiotics together. Do you remember that, the assignment? I hope you have the soft copy for that. Yes, okay. Also, I have taken one assignment and I have, included a few points in that. So I will send the pictures for you so that you can study that three papers and you will cover all the, uh, what do you say, all the topics. Okay, I will share it now. I will just show it to you and then I will, what do you say, I will also send it through WhatsApp. Yes, antibiotics, all the antibiotics, the assignment which you have submitted to us, okay, the table which was having all the uh, antibiotics together. Can you see this picture which I have shared? Okay, great. So in this picture, I have taken one assignment and I have made few changes. So you are going to study the mechanism of action in the table like this. Okay, this is 2 like this. So you have mechanism, adverse effects, therapeutic uses, examples, etc. If something is missing, I have written it as a question mark. So you have to go through the lecture and then you have to study that. Clear, all of you? Okay. So you're going to, for all the antibiotic lectures, you are going to study this 3 pages. And whatever is missing in these pages, you're going to go to the lecture and then you're going to write it down over here and then study. So with this you are going to cover majority of the questions. Clear? One more disclaimer I want to put: whatever is being told in the revision, it is not necessary that you will not get any other questions. You have to study everything, but concentrate on what I have told in the revision. Okay, this is the disclaimer. You have to study everything. Very good. Good. Intelligent people. Great. So this is about antibiotics. Done, all of you. And remaining is antibiotic introduction. So introduction, you have to study. It's easy only. So I think you can study the introduction. Wait, let me. Please, all of you take the introduction slides. Okay. Is this lecture with you now? Antibiotics? Okay. So in the introduction, what is their introduction? Is there, what are antibiotics? What is bactericidal, bacteriostatic, all these things. This also, bacteriostatic. What is the mechanism by which antibiotics act? Okay. Intracytoplasmic, extracytoplasmic. Bactericidal, bacteriostatic. And what are broad spectrum, narrow spectrum. What is antibiotic resistance also, Yeah, what are the mechanisms by which antibiotic shows resistance, which is the most common? What is resistance and tolerance? How it can be prevented? Antibiotic prophylaxis. What is prophylaxis? Which drugs are mostly preferred for prophylaxis? Okay, this is for antibiotic introduction. Okay, so this is done. Now next what we have? Okay, for all the, oh, going fast. Okay, I will slow down now. For all the lectures related to the oral health conditions, what are the lectures? We have teeth whitening agents, we have anti-caries, anti-gingivitis, we have, what are those mummifying agents, and obtundant. So many lectures are there which are related to the oral health conditions. Okay, so these lectures, for the lectures which are related to the oral health conditions like antiseptics, anti-caries, mouthwashes, tooth whitening agents, for all these lectures you have to know the definition you have to know the examples. Okay, all of you. And for the dentrifices, you have to know the use of each and every ingredient. What is added in the dentrifies? What is added in the toothpaste? What is the use of that? Okay, clear? Definitions, examples, and in dentrifies, what is the use of each ingredient? This is related to the lectures which are highlighting or which are related to the oral health conditions. Next, we are going to the antiviral agents. So please take the lecture antiviral. Okay, so in the antiviral, aminoglycosides is related to the antibiotics. So we are going to jump directly to the antiviral agents. Okay, so these are the antiviral. In the antiviral, you have to know important points from each class. Okay, what is the use of acyclovir? What is the use of zydiobudine? What is the use of lamivudine? What is the use of protease inhibitors? And this chart is very important. In this, you must know what is the difference between low risk and high risk. Okay, clear all of you? This is for antiviral agents. Which of them? Abdullah, I did not get you. Okay. So this is related to the antiviral agents, and with this lecture, you have the antifungal agents also. That is of, I think, one or two. Related to antifungal drugs, you should know what are the common types of fungal infections. What are the adverse effects? Okay, that is about the antiviral agents. Okay. Next is in the part 1 we have the last thing, that is the cancer. Okay, anti-neoplastic agents. So in the cancer lecture, you must know what are the toxicities related to different category of cancer drugs. What are the adverse effects? Okay. And what is the combination therapy? Adverse effects, what are the combination therapies? Clear, or you want me to show the slides? Anti-neoplastic. Okay, you know what is cancer, what are the combination chemotherapy, what are the combination chemotherapy, what are the advantages of that, what is the role of anti-neoplastic agents. You already know what is this, you know mechanism, you know the tissue of origin. Yeah, what are the immediate effects? What are the delayed effects of anti-neoplastic agents? And then what are the oral complications of cancer therapy? You already know this and you should know this very thoroughly. Oral complications and what are the treatments? Then you have different drugs, different category of drugs. You have 5 category of drugs. You should know what is the mechanism of each category of drug, okay, and the toxicity of each category of drug, mechanism and adverse effect or toxicity if it is having each category of the drug. Okay, alkylating agents, plant alkaloids, anti-tumor agents. Okay, and apart from that, hormone therapy and immunotherapy. What is the mechanism, uh, and what is the toxic effect or adverse effect, like that. Okay, so this finishes our first part of the syllabus. Okay, antibiotics, antiviral, oral health conditions, and cancer. Now coming to the second part of the syllabus, that is related to the emergencies, as I have written in the whiteboard previously. That is related to the emergencies. Now lectures related to the emergencies are very easy. You have medical emergency, you have fear and anxiety, you have poisoned patient, and shock. So all these lectures you have to study, and it is very easy. You don't have much complicated information in that. In the medical emergencies, concentrate on the management and the medications that are used in case of emergency. If somebody is having angina pain, what is the medication? If somebody suffers with syncope, what should be given? If somebody is suffering with allergic reaction, what should be given? If somebody is suffering with asthma, what is the drug given? Okay, and how to manage such type of people in emergency. Fear and anxiety, there are different scales in the lecture of fear and anxiety, and in each scale you have the Cora's dental scale, you have the modified anxiety scale, you have the child anxiety scale. You remember, right? The questionnaire, I told you in the lecture, it is having questions. Questions means it is having items, 20 items, 4 items, and you have scores related to that. So that score will denote whether the patient is anxious or not, right? So you have to remember that. Clear? Next comes the, what is the next? Poisoned patient, okay? So for poison patient also, it is very simple. You have to remember how to, you know, what do you say, manage such type of people. It is also an emergency situation, right? Yes, how to manage the poison patient. And excuse me. Yes, another important thing for poison is antidotes. Because it is a poisoning case, we have antidotes, right? There is a slide which shows the antidotes of certain type of poisoning. In that slide, some antidotes are missing also. You have to go back to the lecture, search for the antidote, fill it in the slide, and study it. Okay, like barbiturate poisoning, opioid poisoning. I did not write the antidote over there because we already studied it in our previous lectures. Go to the lecture, search for the antidote, write it in that slide, and study. Clear? Okay. So that is about poison patient. Next is shock. Shock is having only 7 to 8 lectures, so you have to study about shock. Okay, that is very simple also. Next is what? So all these lectures are very simple. Try to study whatever I told you, and apart from that, just go through the other things also. So this finishes our second part related. Now coming to the third part of the syllabus, which I told you, it includes pain, prescription writing, drugs of abuse, toxicology, etc. Right? Autocoids also. Now in this, among these lectures, first study the prescription writing. Okay, so prescription writing, it is very interesting lecture also, so I need not tell you. You have, it is very easy also, there are no drugs, nothing is there. You have to study prescription writing. And then what is next? For the elderly care patient, that is the geriatric pharmacology. All these lectures are very small, girls and boys. So you study everything. It is very small. I think 7 or 8 slides are there. Geriatric people, what are the precautions you will take, and concentrate on the definitions. Okay, what is toxicology? What is drug of abuse? And what else is there? For pain also, uh, pain also you study. It is also simple NSAIDs and opioid analgesics. Concentrate on the introduction of pain. Introduction of pain. Concentrate on that and then study everything. Okay, I think like this, I hope you will score good marks. If you have any questions, you can ask. No, I I already uploaded the syllabus in the Blackboard. Okay, so follow that syllabus. And it's, as far as I know, there is no what lectures you had in quiz. Yeah, you had blood, and from the previous semester you had anti-diabetic and calcium, right? No, so you don't have these lectures in the. You don't have lectures from the quiz in the final exam. Clear. Any other thing? See, I tried my best to make it, make the revision as easy as possible for you to study. And I hope if you follow it carefully, you can score good marks. Again, I'm telling you that do not complain later that this was told in the revision, but it did not come because this is a revision class. You have to study everything, but concentrate on the revision. Yes, Abdullah, thank you for my title. You have told this in the beginning also and today also, so I will remember this. That I don't know. How much percentage will come from this? Any other thing? So I will send you the pictures of this table on the WhatsApp of the leaders. So whatever is missing, I have put a question mark in the answer. So fill that and study that, and inshallah you will cover the antibiotic lectures. Okay, so shall we end now? Shall we end the session? Anyhow, if you have any other doubts, also I'm available on WhatsApp. You can message me. I will reply. Exams, and especially all the best for your pharmacology exam. Do not panic. Relax. Read the question and study. Okay. Okay then. Take care. Good night, all of you. Inshallah, it will be easier if you study well. Okay. Good night.